Assalamu alaikum. I'm Dr. Irfan Ahmed Chaudhary. I'm consultant orthopedic surgeon in Mayo Hospital, Lahore. So the purpose of today's video, without wasting any time, is a message for clinical examination candidates who are going to appear post-COVID first time. As there is a lot of ambiguity, a lot of stress among the candidates, and I'm very thankful to all our respected seniors because they have always been very kind to the juniors. Many professors, they have given brief sessions, whether on camera, whether to direct to the candidates regarding exam pattern, and to decrease their anxiety and to make them more aware of the exam. So first of all, I want to give you an advice that do not, now up till now the information that you have got about the exam is enough. Now sit together, keep preparing your exam, and do not feel lost at all regarding the pattern. Now I will give you a brief example, and then I will just tell you the most important cases. I may skip a few, but at least after doing these cases you will be able to cover a lot of things. So let's start. Suppose there is a long case. The long case is, examiner will tell you. Before going through the example, let me clear you that no examiner, no official or non-official member can say that each and everything will happen in the exam according to my advice or my briefing. There will be some variations, there will be some things that even the examiner at this time may not be knowing. That is not that they are unaware, but the thing is, in clinical exam you cannot tell everything black and white. There can be some changes. So let's start with a long case example of the hip case. There will be a scenario, 36-year-old male presented to you. There will be a picture. Now start your history. You will say, you will start the history with the same pattern. One of the examiner will give you the answers when you will ask the questions about the history. You will ask, what is your name? Muhammad Ali. Where are you from? Lahore. What do you do? I am a laborer. Are you married? How many kids? What hand dominance do you have? You have asked this question from the examiner. Now you will ask, what is your complaint? The examiner will give you the presenting complaint. So here we are, there may be a change, there may be already written presenting complaint, but there may be, you may be asked to take complete history, and you will ask the examiner, क्या मसला है आपको? What is your presenting? He will tell pain in left groin, or he will say pain in hip joint. Then you will dissect it like the candidate and the patient. जोड़ में नहीं दर्द, आपको किधर दर्द होती है? आगे है, पीछे है, किस जगह? He will then tell you pain in groin or pain in gluteal region. Then you will take whole history, when it started, how it started. If there is a history of trauma, you will ask every question from the examiner, and most likely the examiner will not be able to answer so many questions. In the end, he will give you the positive findings of the key that he has of that long case. So this will also be a blessing for the candidates, because we asked too many questions from the patient. कैसे हुआ था? कौन आपको लेके गया था? वहाँ पे इनिशियल मैनेजमेंट की, उसके बाद क्या, उसके बाद कहाँ गया, उसके बाद. So these are all the questions. So that's it. You took history, and now you may be provided with a sheet. You will keep writing only the positive points. Then you will take history of presenting illness, you will take past history, medical history, surgical history, all the points, personal history, socio-economic history, and family history, and in pediatrics you will take birth history, vaccination history, and the other developmental milestones. So all these you have taken. Now the next step, examiner will say, what will you do? We are doing the hip case. You will say, I will go for, sir, I will check the gait. Okay, he will check, he has a gait that has short stance phase and a longer swing phase. What type of gait it is? Or there may be a video of the gait pattern. He will show you, okay, look at the gait. You will say this is antalgic gait, short limb gait, Trendelenburg gait. You will tell him. Then he may ask you question right there or after you complete your examination in the viva. So you will tell, after gait, sir, I will go and I will inspect from front, side, back. Or you will say, after gait, I will ask him to sit and squat, and I will ask him to stand on tip and toes, and then I will inspect, and then I will do Trendelenburg test, and then I will ask him to bend forward, do the Schober test. If it is positive, he will say the Schober test is positive. You will say, I will do the wall test, I will do the chest expansion, these tests. Then you will say, I am going to make him lay down. Now, till now the examiner has something in his keys. He may show you the gait or all the pictures, or if they don't have all this in their question, they may ask you. What you will ask, Doctor? You will tell, I will ask, I will see, I will look. You have to complete the points of examination. And I would say that at this time, the Surviving Orthopedic Clinical Exam book with some additions maybe is the best to memorize all these examinations in a quick way. So you will say, I have now gone for palpation. Okay, palpation, what are the steps, what are the point, tenderness, all these things, temperature, tenderness, pulsation, measurements. Now he will stop you right there. You will say, I will check Galeazzi sign first, then I will go, I will mark the points, I will check the measurements, LLD, apparent LLD, true LLD. He will ask you what are the points, how do you calculate apparent LLD, true LLD. Then you will say Bryant triangle, what is inverted Bryant triangle, and all these points. Okay, then he will keep telling you the positive findings, or he will keep showing you. There are two possibilities, anything can happen. Either he will keep telling you, the main aim is you have to know all the points. You have to know all the points about the history, about the clinical exam. And now you are doing the clinical exam, you have told him the measurements, lymph nodes, and then you have checked sensation are not that important, but you can say, and then you will go for done with the measurements, and then you will go for some movements. Then the movement starts with the Thomas test. He will definitely ask about you about the Thomas test, modified Thomas test. He may show you the picture. He will ask you what type of Thomas test is it, modified, what are the uses and all that. If there is contracture on the knee as well, then we go for the modified Thomas. So then Thomas test, then the flexion, extension, adduction, abduction, rotation. Now examiner will ask you, how will you do adduction, abduction? What are the important steps? I have shown you in the in my book as well. How we check adduction, abduction? We keep hand over that point and then we do. Okay. Now he will say, okay, what are the special tests? You will tell telescoping is the special test, SLR, Faber, Feder, Ubers, and on prawn there is the other test, femoral nerve stretch test or abnormal mass palpation, and all these tests. And in all this you have a look at the spine as well in inspection. So this was the all. Then he may ask, or he will definitely ask, compose yourself in 5 minutes, we will, and give us details. So you must be fluent in telling that Aslam, 45-year-old male, resident of Lahore, laborer by profession, married since 20 years with 5 kids, presented to us with a presenting complaint of the pain in the left groin radiating to left lower limb. And then you will start all the history of presenting illness and all the positive points. They will say, just tell us the positive points. So one thing, one blessing is this: you are not going to perform and you are only telling. And another blessing in this system is that examination will not tolerate too many questions that we ask, the patients and he will tell you the positive findings quickly, so that can be very helpful. And then these two things, the every system has pros and cons, and the cons which I see in this system is this, that he may ask you interpretation and the details. So this was a sample. I hope this will help. Now quickly I want to make this video short so that your time can be saved. In HIP you must do the vivas are very important now. So what vivas and what clinical examination is important? Neck of femur non-union, most important, and the most candidate fail on neck of union, non-union neck of femur. TB, hip, Perthes disease, and post-septic arthritis, sequelae of septic arthritis, chronic dislocation of the hip, very important case. Other cases are not that important. Then coming on to the knee genu varum, genu valgum, very important. And regarding arthroplasty, hip and knee, you must be knowing details. They may show you the x-rays of arthroplasties, so you must be knowing the details. So if I couldn't cover all the cases in this video, I will keep it to lower limb. I will upload another video for the upper limb. So then coming on to other cases of the knee, I have told you regarding knee case, genu valgum, genu varum, recurrent dislocation of patella, very important, very important. And then osteoarthritis of the knees, it is very important. Multi-ligamentous injuries of the knee, anterior cruciate ligament injury of the knee, and these are the cases mostly from the knee. Swelling is something separate that can appear in the exam. So I have written somewhere, so I am also looking at that. Sometime isolated PCL injuries can also come. So now coming on to foot CTV, the command and grip on CTV viva must be very much up to date, because CTV, DDH in DDH less likely, but now it can appear in exam, but more chances in TOEICs. So CTV, CVT, and foot deformities, other foot deformities like Charcot-Marie tooth, and foot drop, very important case, foot drop. So these are the cases from the lower limb. And then coming on to the upper limb, if I start from the hand, although I have covered the upper limb section, the upper limb, all the peripheral nerves in the wrist, so all the peripheral nerves, claw hand, and after that tendon injuries. Peripheral nerve include median ulnar and radial, and they include all. If you are doing carpal tunnel, you must be knowing about the cervical root compression, Guyon canal, ulnar nerve, everywhere. So in wrist, other than this, claw hand, and very important is the other thing is that in hand we often see that the any tumor of the wrist, but we will cover it in tumor section. And the other let me check my list, just a minute. I will end this video on the wrist and shoulder, elbow, spine, and for pathology I will upload another video. So Dupuytren's disease, it can appear, tendon injury, it can also appear, and yes, mad lung deformity, very important, malunited all radius ulna fractures. And just another case I wrote in my list was if I can find, and the other, yes, very important, Walkman ischemic contracture, that is very important. So up till now this video I have told you the cases. Now in next video I will give you a short case sample along with shoulder, elbow, spine, neuromuscular diseases, and tumors. The list, it will be uploaded soon, maybe tomorrow inshallah ta'ala. So best of luck to all the candidates. You can do it. It's very simple. The advice is sit together, don't waste your time, Don't go anywhere, just sit together and do maximum practice of speaking and viva. So I hope this video will serve the purpose. Remember me in your prayers. Thank you so much. Allah Hafiz.